Hi, I'm Dr. Norris from Amicus Health. We've put a short video together to explain more about the bowel cancer screening programme. Screening programmes are designed to pick up a diagnosis of cancer earlier, which helps enable faster diagnosis and then more successful treatment. Bowel cancer screening is available to everyone between the ages of 60 and 74. You will be sent a testing kit in the post every 2 years. People above the age of 74 can request testing kits by contacting the bowel screening programme directly. In England, the bowel cancer screening programme involves a test called the fecal immunochemical test. This test involves collecting small samples of poo that are analysed for traces of blood that could suggest a diagnosis of bowel cancer. You will receive an envelope in the post with a testing kit. There are detailed instructions in the envelope, but basically it involves collecting a small sample of poo onto a stick, putting it into an envelope and posting it back. Over 95% of these tests will come back as normal, but in the small minority of people with a positive test, you'll be invited to discuss the results of these with a bowel specialist who might suggest performing further investigations to find out the cause. Most people with a positive test will not turn out to have bowel cancer. However, to be certain, the bowel specialist might offer you a camera test to look at the inside of your bowel in more detail. If you are eligible for a test and you've either missed or changed your mind about wanting to do a test, you can contact the bowel cancer screening programme directly and ask for a new testing kit to be sent to you. Bowel cancer is one of the most common cancers in men and women in the UK. Cancer screening is easy, safe and painless, and it can help us pick up cancers earlier, therefore enabling more successful treatment.